Hello everyone, and thank you for watching this evening, and also thank you Dr. Naumann for joining us here on this discussion on the flu. If anyone has any questions, please feel free to write them in the comment section and we'll discuss them after. So Dr. Naumann, some people may be contemplating getting a flu shot. Is that something you recommend your patients get?
Certainly, I think our CDC recommends that everyone 6 months and above get the vaccine this year. And I think it's really important to remember that, you're not only potentially, when you get the vaccine, you're not only potentially preventing yourself from getting sick, but you're preventing family members, colleagues, peers, and I think that's really important to keep in mind too.
All right. What are some common trends you have seen thus far in the flu or expect to see this year?
That's a great question. It's a little bit early. We're just starting to see a little bit of flu activity in the area. Most of the activity right now is in southeastern United States, Alabama, Mississippi, Georgia. But we do know that it's very unpredictable from year to year, so it could be a big one, it could be a really mild one, and we're hoping for the mild, of course. I think one of the things I want to keep you guys to know that is that the vaccine this year has been updated, so there's new strains of the virus that we can protect you against that we've seen across the world.
Okay. So what are some common flu symptoms?
Well, I think we all know most of those. It's kind of like the common cold, but much more intense and much more rapid onset. The fevers, chills, sweats, the cough, sore throat, muscle aches, body aches, that runny, stuffy nose.
All right, and what should someone do if they have these symptoms?
Get to their doctor, provider as quickly as they can. And the main reason for that is if you really think you have the flu is that there is medicine available. Tamiflu is one of them that the CDC recommends. But the reason we want you to get in early and not wait is because the medicine is best used started in the first 48 hours of symptoms. So don't sit around at home wondering and thinking that you're going to ride it out. If you really feel like you have the flu, get in and get seen.
All right, and what are some ways that someone can prevent from getting the flu?
Oh, the vaccine, the vaccine, the vaccine. And of course, all the other good stuff that you already know about, avoiding close contact, staying at home if you're sick, which I know is not very American. Our culture is go to work when you're sick, but really, if you have sick time, stay at home, you're going to heal up faster, and you're not going to spread it around the office or your workplace. Cover your nose and your mouth, clean your hands, wipe down the tables and desks and the utensils and things that you have around the house that you're using. Drink lots of water, get your rest, eat nutritious, all those good things.
All right. And how can Hampton Roads Urgent Care help in preventing the flu or providing medical treatment for one who has the flu?
Sure. We have here at our facility, we have expert staff that's ready to do either one, and that is prevention. We have the flu vaccine here available, so we can give you the vaccine. The other thing is, of course, we can diagnose and treat you. We have the rapid flu tests here that are very accurate, so we can go either direction, and we're all ready for you.
All right, Dr. Naumann, do you have any final thoughts on this topic?
I think the one thing I want to keep in mind for everyone is that the injectable vaccine is the only one the CDC recommends, and there's several that are out and they're all FDA approved. The nasal vaccine that we used to give a couple of years ago is still not recommended by the CDC, so don't get that one. The other thing to keep in mind is that the children between 6 months and 8 years of age, if they've never had the vaccine, the first time they get the vaccine, or the first year, they need 2 doses, and they're a month apart. So this is a great time to get the vaccine because the flu season's just beginning to start, and those children need a second dose about a month later to have full immunity. So always keep that in mind. I think one of the other things I wanted you guys to remember is that anywhere between, it depends on who you read, between 250 to 750,000 people are hospitalized with the flu and flu complications every year. So 500,000 people, give or take, every year are put in the hospital because of the flu and the complications from the flu. So I know a lot of us try to ride it out, and that's fine, but the reality is if you're sick, get seen, get on medicine, and if you're not getting better, get back in because the flu can get us pretty hard.
All right, well, thank you, Dr. Naumann, and thank you, everyone, for watching today.